dose response curve. Okay? So dose response curve, as the name tells, it is a curve. So we were discussing about dose response curve. So this is a curve. As the name tells, curve. What is curve? You know, curve. I'm not talking about 36, 24, 36 curve. Curve in pharmacology means graph. So it is a graph between dose and response. So what will happen if we plot a graph between dose and response? So on the x-axis, we keep the dose. On the y-axis, we keep the response. Now we want to plot a graph. So what we basically do, we give a small dose to a person, then see the effect. Then we increase the dose and see the effect. Then increase the dose further, see the effect. So in this manner, we keep on increasing the dose and plot a graph. So literally speaking, suppose we have 100 receptors of a particular substance in the body, and we give 10 molecules from outside. So they will stimulate 10 receptors only. So that will produce lesser action. If we give 20 molecules, they can stimulate 20 receptors, more action. If we give 40 molecules, they can stimulate 40 receptors, still more action. So we keep on increasing the dose, response keep on increasing. But at one time, when all 100 receptors are stimulated, now even on increasing the dose, response will not increase. That means even if we give 200, 300, 500, 1000 molecules, maximum effect can be because of 100 receptors only. So that means with increase in dose, the response increases first. Keep on increasing. But at one time it become constant, it will not increase further. So this is the classical shape of DRC, dose response curve, and mathematically this curve is known as hyperbola. So if someone asks you what is the shape of dose response curve, it is hyperbola. But there is a problem with this curve. What is the problem? It is not a straight line. If we want to compare different drugs, we want to do different things, we want straight lines, because straight lines can be easily compared, but it is a curved line. So curved lines are difficult to compare. So what we want? We want a straight line. So how to make it a straight line? So to make it a straight line, we do a little modification. What modification we do? We will just add a logarithmic thing on the x-axis. So instead of dose on the x-axis, we take logarithm of dose, y-axis remain a response. So the shape changes. So when we plot a log DRC, that means on the x-axis there is log dose, and on the y-axis there is a response. Now the shape changes. It do not remain hyperbolic curve. Now it become an S-shaped curve. S-shaped curve, and this is known as sigmoid curve. So remember, the shape of DRC was hyperbola, whereas shape of log DRC is sigma. Okay? Now the first question, why we converted into logarithmic form? Why we do log DRC, not we do not do DRC? Log DRC क्यों कर रहे हैं हम? क्या चाहिए था हमें? What did we want? क्या चाहिए था हमें? We wanted a straight line. But when we plot a log DRC, what we noted, it is curved from this point also, and it is curved from this point also. जो DRC था, that was curved only at one point. But this is curved here also, here also. ये तो फायदे की जगह नुकसान होगी. So what is the advantage of converting into logarithmic form? It is bent at 2 points. Okay? तो क्या फायदा हुआ? So if you see carefully, the middle portion, this portion is a straight line. Middle portion is a straight line means if we give lesser dose than this, adequate response is not there. If we give more than this dose, usually the toxicity will occur. So clinically, we are most likely to give in this range. And the range which we are using clinically, that is falling in a straight line. So that's why we can use log DRC. So what is the advantage of log DRC? Although it is a sigmoid curve, but the middle portion, which is the clinically most relevant portion, it is a straight line. So middle portion is a straight line. That is the advantage. Okay. So this is number one. Middle portion is a straight line. So we, instead of converting into hyperbola, we have converted into sigmoid. The middle portion is a straight line. So we got middle portion which is straight, so we can compare. Now, apart from this, what is the other advantage or disadvantage of converting into logarithmic form? We do not use DRC anymore. We always use log DRC. Why log DRC? Why not DRC? Now tell me. This we have not discussed in our videos. So why we use a DRC, not log DRC? Tell me. Most important thing, biologically, the responses are in logarithmic fashion. So it is not that we double the dose, the effect doubles. But when we make the dose 10 times, then the effect doubles. So usually the biological system works in the logarithmic form. So the graph will be more biological type, that means more actual type when we plot in the logarithmic form. And third, and the most important reason why we plot in the logarithmic form, if you see, if we see in the logarithmic form, there will be equal distance between 10 times. So you can see there will be equal distance between the 1, 10, 100, 1000. So logarithm works like this, multiples. Whereas if we plot here in a normal without log form, it will be 1, 2, 3, 4, 5, 6, 7, 8 like that. Clear? So what is the difference is when we plot in a logarithmic form in a lesser space, we can plot too many doses. Like we want to plot between 1 and 1000. And we are plotting without dose, so it will be 1, 2, 3, 4. For 1000 we need a very long paper. That is practically not possible. So what we do in logarithmic form. So we will make it 1, 2, 4, 8, 16, 32. So 1000 will become quite easy. So multiple doses can be plotted easily in the logarithmic paper. Okay, so three important reasons why we do log DRC. We do not plot a normal DRC without logarithmic DRC. Number one, it gives us a sigmoid curve, the middle portion of which is a straight line. Number two, natural biological responses occur in the logarithmic form. And number three, multiple doses we can plot in lesser space. Okay, you understand now why we use log DRC? We do not use a standard DRC. Yeah, so we always use log DRC. We do not use a DRC anymore. The only question that is asked from DRC is what is shape of DRC? It is hyperbola, whereas what is shape of log DRC? It is sigmoid. Yeah? So in our further discussion, wherever we will discuss, we always use log DRC, but we commonly keep on saying DRC because by not speaking log, we save 0.05 seconds of time, which is very, very crucial for us. Okay, so what are the important parameters we can obtain from log DRC? The standard log DRC which we obtain, it is known as graded DRC or graded log DRC. Graded simply means on the y-axis we plot a grade. We put a grade of the dose. That means lesser dose, slightly more dose, slightly more dose, slightly more dose, maximum dose. Response. So on the y-axis, response is plotted like if we see the effect of a drug on blood pressure. So increase in blood pressure by 10 millimeter, 20 millimeter, 40 millimeter, 80 millimeter. So if we are plotting a grade of response on the y-axis, it is called as graded DRC. So what is the important things we obtain from the log DRC? We obtain three important parameters. One is called as potency. Second is called as efficacy. And third is called as slope. So we obtain three important parameters: potency, efficacy, and slope. So what are these things? We'll discuss these one by one, starting from potency. So potency, what do you mean by potency? क्या होता है potency? So as the name tells, potency. No, I am not talking about वो बाबा सारेम वाली potency. ठीक है, राम रहीम वाली potency, उनकी बात नहीं कर रहा मैं. Potency क्या होता है? Potency PO, start with PO. PO means tell the power of a drug, how powerful a drug is. Power means suppose we have two drugs, both are used to increase blood pressure. One drug A, it can increase the blood pressure by giving a dose of 10 milligram, whereas a drug B increase the same amount of blood pressure when we give 100 milligram. So which drug is more powerful according to you? So obviously this drug is more powerful. Why A is more powerful? Because we require lesser dose. So that means the drug which produces similar response at lower dose is more potent. So potency is always relative. We cannot say this is potent drug. It is always comparison between the two. Okay, so a drug which is required in lesser dose is more potent, which is required in higher dose is less potent. Okay, so if we plot a DRC, so can you tell me which drug is more potent, which is less potent? Suppose this is log dose. This is a response. So this is the first drug, drug A. This is second drug, drug B. According to you, which drug should be more potent? So it's very easy. So we see dose. Dose is on this axis, x-axis. So this left side is lesser dose, right side dose keep on increasing. So if we want a particular response, suppose this response, we see that this response is produced by, suppose here 10 milligram of a dose. Whereas in case of B, the same response is produced by 20 milligram. So which drug is more potent? Obviously, which is producing at a lower dose. So that means the drug A is more potent. So by looking at the DRC, you can easily tell which of curve is on left side of the graph that is more potent. So just look at left and right in case of potency. Left-sided curves are more potent drugs. Right-sided curves are less potent drugs. So potency is left and right. Left is more potent. Right is less potent. Okay. So that is potency. Now coming to efficacy. So what do you mean by efficacy? Efficacy, as the name tells, it is effect of a drug. Effect means a response. But what is the difference? Efficacy is maximum effect of a drug, and add to this regardless of dose. That means in case of efficacy, we never talk about dose. We only see which produce more effect. Clear? So whatever dose may be, if one drug produce more action than second, even if we need to give 1,000 times high dose, it will be more efficacious. Okay, so efficacy, simply see which curve is higher. Remember response here. Higher response means more efficacy, lower response means less efficacy. So if I plot another graph here, suppose this is a drug C and this is a drug D. So which is most efficacious? Most efficacious, the highest curve C. Least efficacious is the lowest curve D. So efficacy simply means height. More height, more efficacy, less height, less efficacy. So this thing you can remember easily whenever they talk about potency or efficacy in a log DRC. Always take help. Do not hesitate from taking the help. This is true in life also. Whenever you are stuck, do not shy away from taking help. So what is help? Help says height tells about efficacy, means more height, more efficacious, less height, less efficacious, and left-sidedness tells about potency, more on the left, more potent, more on the right, less potent. So again, making a graph. Now, can you tell me quickly with the sequence of potency and efficacy? So this is a response. This is log dose. I am randomly writing several drugs. So this is drug A, this is drug B, this is drug C, this is drug D, this is drug E. So tell me the sequence of potency and sequence of efficacy. So it is very easy. So how will she? Remember, help. Height tells about efficacy. So if we talk about height, the highest curve is E. So the most efficacious is E. Then below the E we have B. Then below the B we have A. Then we have D, and then we have C. Okay. So E is most efficacious and C is least efficacious. Easy one. Then potency, left-sidedness tells about potency. For potency, go from left to right. So potency, most potent is A, followed by B, then followed by C, followed by D, and followed by E. That is the sequence. Okay. So potency left to right and efficacy high to low. You can easily tell about this. Now coming to the important thing, there is a term similar to efficacy commonly used, that is effectiveness. So what is the difference between efficacy and effectiveness of a drug? दोनों में फर्क क्या है? Efficacy में और effectiveness में क्या फर्क है? पहले होता क्या है? We'll try to understand what are the meaning of these terms. So we'll understand in terms like you must have seen advertisement of a car in television. So they give an advertisement that this car gives an average of 20 kilometer per liter. Okay, so we buy that car thinking that 20 की average मिल जाए. तो हिंदी में समझाता हूँ कि गाड़ी की ऐड आती है, उसमें कहते हैं कि इस गाड़ी की एवरेज 20 किलोमीटर पर लीटर। तो हम ये सोच के कि भैया बड़ी सस्ती पड़ जाएगी, पेट्रोल तो इतना महंगा है, तो हम वो गाड़ी खरीद लेते हैं कि 20 की एवरेज मिलेगी। बट जब हम वो गाड़ी चलाते हैं, व्हेन वी ड्राइव दैट कार, व्हाट वी गेट एन एवरेज ऑफ 10, 11, समटाइम्स 12। हाईवे पे चले जाते हैं तो 14, 15 भी मिल जाती है, ठीक है, बट वी नेवर गेट एवरेज ऑफ दोस 20। नाउ द क्वेश्चन इज, वर दे लाइंग? जो एडवर्टाइजमेंट दे रहे थे क्या वो झूठ बोल रहे थे? नहीं, वो झूठ नहीं बोल रहे थे। देयर आर टू डिफरेंट थिंग्स जो वो बता रहे थे। दैट वाज एफिकेसी, दैट मींस मैक्सिमम यू कैन गेट, और जो हमें एक्चुअल में मिलता है दैट इज इफेक्टिवनेस। तो एफिकेसी टेस्ट करने के लिए व्हाट दे हैव डन इज दे हैव ड्रिवन द कार अंडर आइडियल कंडीशंस। कार वो आइडियल कंडीशंस में चला रहे हैं। कैसे चला रहे हैं कि बिल्कुल प्लेन रोड, उसमें कोई खड्डा नहीं, कोई बैरियर नहीं है, तो बिल्कुल प्लेन रोड है, ठीक है, गाड़ी उसमें चल रही है, प्लस कोई उसमें रेड लाइट नहीं है, कोई ट्रैफिक नहीं है, कोई गाय नहीं आएगी बीच में। सो व्हेन वी कंटिन्यूअसली ड्राइव द कार एट 45 किलोमीटर पर आवर, देन वी गेट दैट बेस्ट एवरेज। सो दैट इज कॉल्ड एफिकेसी। सो एफिकेसी इज अंडर कंट्रोल्ड कंडीशंस, कंट्रोल्ड कंडीशंस। बट व्हेन वी कम टू एक्चुअल प्रैक्टिस, जब हमने वो गाड़ी खरीद ली, सो वी विल नॉट गेट दोज आइडियल कंडीशंस। सो व्हाट वी विल डू, जब हम गाड़ी चलाएंगे तो हमें गाड़ी में खड्डे भी आएंगे, ब्रेकर भी आएंगे, ठीक है, बीच में गाय भी आ जाएगी, कई बार रेड लाइट पे भी रुकना पड़ेगा, ठीक है। तो इन सारी चीजों के कारण द एक्चुअल एवरेज डिक्रीजेस। सो व्हाट वी एक्चुअली गेट इज इफेक्टिवनेस। तो इन केस ऑफ ड्रग्स व्हाट वी से, इफेक्टिवनेस इज अंडर क्लिनिकल कंडीशंस. So this thing we actually do when we test a drug in clinical trial. जब हम clinical trial में दवाई को टेस्ट करते हैं, so we put a lot of riders, मतलब जो भी उसकी एक्शन को कम कर सकती है कंडीशन, वो सब हटा देते हैं, ठीक है। जैसे हम कहते हैं कि दवाई के साथ खाना नहीं खाना, दवाई के साथ अल्कोहल नहीं पीना, ठीक है, डायबिटिक्स को नहीं देनी, इस वाले पेशेंट को नहीं देनी, उसको नहीं देनी, तो जिसमें भी प्रॉब्लम होती है वी रिमूव दैट, ठीक। सो वट एवर वी गेट विल बी बेस्ट. So that is under controlled conditions, so that we test efficacy. So in clinical trials we test efficacy. But when we talk about actual clinical practice, when the drugs comes in the market, जब दवाई मार्केट में आ गई, we will not get that thing. क्यों? क्योंकि हमें हो सकता है डायबिटिक पेशेंट भी ले रहा हो दवाई, ठीक है, रात को दारू पीना भी जरूरी है, तो we are doing many things which may decrease the action of that drug. So what we actually get is effectiveness. ठीक है, तो क्लिनिकल ट्रायल्स में वी डू एफिकेसी टेस्टिंग, बट इन एक्चुअल क्लिनिकल प्रैक्टिस वी सी इफेक्टिवनेस. नाउ अनदर इंपॉर्टेंट थिंग इज विच इज क्लिनिकली मोर इंपॉर्टेंट, एफिकेसी इंपॉर्टेंट है या इफेक्टिवनेस ज्यादा इंपॉर्टेंट है? क्लिनिकली ज्यादा इंपॉर्टेंट क्या होगा आपके हिसाब से? एफिकेसी इज मोर इंपॉर्टेंट और इफेक्टिवनेस इज मोर इंपॉर्टेंट? तो ऑब्वियसली इट इज इफेक्टिवनेस, है ना, क्योंकि जो हमें मिल रहा है वही तो इंपॉर्टेंट है. इफ वी सी फार्माकोलॉजी बुक, मेडिसिन बुक खोल के देख लो, you will get this word efficacy 100 times. This drug is more efficacious, this is less efficacious, but this effectiveness hardly you will get once or twice. अगर effectiveness ही ज्यादा इंपॉर्टेंट है तो हम effectiveness की बात क्यों नहीं करते, हम efficacy की बात ही क्यों करते हैं? Why we always keep on talking about efficacy? क्यों? सपोज आपको बोलें कि आपको एक कार की एडवर्टाइजमेंट करनी है, यू वांट टू एडवर्टाइज अ कार, कैसे करोगे एडवर्टाइजमेंट? कि ये एवरेज 12 की देती है, 14 की देती है, हाईवे पे ले जाओ तो 16 भी दे सकती है, बहुत और बढ़िया हो जाए तो 18 की भी दे सकती है, कैसे दोगे? ऑब्वियसली फॉर गिविंग एन एडवर्टाइजमेंट वी नीड टू फिक्स द थिंग्स. तो भैया बेस्ट जो है वो 20 है, इससे ज्यादा नहीं मिलेगी. सो दैट इज बेस्ट वी आर टॉकिंग अबाउट एफिकेसी, बिकॉज इफेक्टिवनेस विल वेरी फ्रॉम पर्सन टू पर्सन. मेरे में अलग एक्शन आएगा, किसी और में अलग एक्शन आएगा, सुबह अलग एक्शन आएगा, शाम को अलग एक्शन आएगा, किसी दवाई के साथ खा रहे हो अलग एक्शन आएगा. सो इट विल कीप ऑन चेंजिंग. सो इफेक्टिवनेस इज नॉट फिक्स्ड, वेयर एज एफिकेसी इज फिक्स्ड. तो इसलिए हम एफिकेसी की बात करते हैं. सो व्हेन वी से एफिकेसी, एफिकेसी इज अबाउट अ ड्रग, तो फिरोसेमाइड इज हाईली एफिकेशियस ड्रग. बट व्हेन वी टॉक अबाउट इफेक्टिवनेस वी से इफेक्ट ऑफ फिरोसेमाइड इन रामलाल ऑन 20th of June 2024 at 6 PM. ठीक है, और उस हॉस्पिटल में उस बीमारी के लिए. तो इफेक्टिवनेस इज एक्चुअल क्लिनिकल प्रैक्टिस वी गेट एंड एफिकेसी इज मैक्सिमम और द बेस्ट वी कैन गेट. Okay, so clinically, which is more important is effectiveness. We always talk about efficacy because in pharmacology we talk about drug. क्योंकि फिरोसेमाइड सिर्फ रामलाल को नहीं मिलनी, फिरोसेमाइड तो गब्बर भी लेगा, है ना, फिरोसेमाइड तो बहुत सारे लोग लेंगे, फिरोसेमाइड तो जय बीरू भी लेंगे, तो फिरोसेमाइड as such we cannot say effectiveness, so effectiveness in a particular purse. Okay, now one last thing, among the potency and efficacy which is more important? Effects, efficacy, effectiveness तो समझ आ गया ना आपको? व्हाट इज मोर इंपॉर्टेंट इन पोटेंसी एंड एफिकेसी? क्लिनिकली पोटेंसी ज्यादा इंपॉर्टेंट है या एफिकेसी ज्यादा इंपॉर्टेंट? लेट मी नो. क्लिनिकली विच इज मोर इंपॉर्टेंट, पोटेंसी और एफिकेसी? कौन ज्यादा इंपॉर्टेंट है?